Good morning, everyone. Look at this. This is right from my backyard here in the morning. Can't wait for it to get a little warmer so I can sit out here and we can talk more and make some more videos on cool subjects. So in this video, I'm going to talk about why PTs get so many medical doctor referrals and even attorney referrals and how you can steal all of those patients. And I said, insert diabolical laugh here. Haha. So I'm not going to tell you anything that's unethical. I'm not going to tell you anything that's sketchy or anything like that. That's not how we roll at all. But I am going to break down how this referral process works and how these providers out there think of physical therapists and how they think of most chiropractors and how you can make some little tweaks so that you can get lots of referrals from medical doctors and sometimes personal injury attorneys as well, depending on how you position yourself. So let's just talk about this real quick. Medical doctors. Let's say that you are a patient that goes in to see a medical doctor. You have an injury. Good morning, Brandy Hunter, office manager at Gonstead Spine and Wellness. How's it going? Okay, and you are seeing a patient who came in for neck pain and headaches. All right? These ducks out here. Look at that. These ducks must know that we're doing a recording. All right, I think they took off. So imagine you're a medical doctor, you're seeing a patient that has neck pain and headaches. They come in and they say, hey, that chiropractors are going to violently twist someone's neck and it's going to throw them into a muscle spasm and hurt them. So why would you ever refer them to make this person worse? And then they're going to come back to you and, right? That's how the medical doctors think. That's how they think of all of us chiropractors. They think that's all we do, refer their patient over to us. So guess what? They just don't refer. That's most of them. Unless they have like a relationship with a chiropractor and they understand what we do and they understand how you're so different. But now here's how medical doctors think of physical therapists. They think a physical therapist is going to show them some stretches and some exercises and get their muscles to relax and maybe do some gentle joint mobilizations if they even know what to do, which, to be honest, they really don't. They really don't even know what physical therapists do. They just think that they're going to do something exercise related, movement related. Okay, so you probably see where I'm going here with this. So now guess what happens when you're a chiropractor who actually offers those types of services, but not just offers them as like an add-on service, but it's what defines you as a practice. So like, for example, here's how we've done this. We have positioned ourselves and we have used language when we talk out in the public and to our patients. We talk about segment. Someone asks us what we do. We see people by looking at segment, posture, movement. What does that mean? That means that when someone has some sort of movement issue or a health issue, there's usually a component for segment, posture, movement, meaning joints can misalign. Okay, there's ways of addressing that. Posture, everyone knows what posture is. Your posture can shift and distort because it gets. Okay, that's a postural problem. We also measure that, we address that, and then move to do until you're 100 years old or shouldn't hurt yourself, impacts your quality of life. And sometimes movement can cause postural problems and it can cause segment problems. That's how we address it. We look at things under 3 different lenses. This is how we would go in and talk to a medical clinic for which we've done lots of them. And guess what? They're very receptive to what we have to talk about because we can relate with them and meet them on the common ground of what they know. What they know is physical therapy. So if we can talk about physical therapy, we can say, hey, most are looking at muscular issues and their training is that muscle issues and everyone. And while exercise is super important, we know that there's certain patients that you're not going to be able to get exercising and you're not going to be able to get muscular issues to relax if you do not affect the joint and nerve component of it. And then even further, someone has a big thoracic hyperkyphosis, they're bent over and they can't move and they're stiff and rigid. All the exercise in the world is not going to get them past that because their ligament is so deformed and dense that you literally need to remodel the shape of their spine. And we actually do that. But now the difference is that we can identify where this patient needs the most attention. Is it more or a combination of all 3? That's the difference. doctor. If you want to refer your patients all to Joe Schmo physical therapist down the street, that's great and all. Just relying on all the referrals from referring medical doctors, because that relationship, which I've talked about before, is basically the referring tribe, how much care this physical therapist should be rendering. They tell them what body part, what area to work on, and the physical therapist is basically shackled and handcuffed by the system. They can only work on that area, and they do very limited and focused care. Great and all, but you miss a focused issue as far as human beings. We have full body movement issues, full spine issues, full postural issues that need to be addressed as a whole person, right? Someone's squat pattern could be affecting their anterior pelvic tilt, causing low back pain. Okay, so anyway, that's how we present it to a medical doctor. We can show them, hey, you could be sending them to a physical therapist that just does this, or you could be sending them somewhere that can actually really go and dig deep, differentially diagnose what's going on with someone, so properly diagnose everything, and go through not just orthopedic and neurological tests, but do special images if needed. As far as X-ray, we can look at end range X-ray analysis to see if there's any sort of alteration of motion segment integrity, to see if there's spine ligament injuries, if things are moving excessively, if things are not moving enough, and then we can analyze their posture, and we posture based on the height of the individual to an ideal. So very different approach than coming in, doing a basic range of motion assessment, and then having people do run-of-the-mill generic exercises like cat, cow, and bird dog and dead bug until the cows come home, because that's what a lot of places are going to be doing. Not to say we don't use some of those exercises, but we start with that and we get past that very quickly, and we make it a lot more engaged. We organize our exercise protocols in what's called about it. They're compliant to the end, and we get past their pain treatment so they can start to build healthy strength and power, so they can have long-term benefits. So anyway, I know I started this saying how we can steal these patients. And it's not that you're stealing anything. It's that you are educating your referral partners in a much higher level, because you're delivering a higher service. So first you have to deliver a higher service. You got to set your clinic up to be able to do this. And it's not that daunting of a process. We've done all the heavy lifting in place. We put all the training in place, and you can actually do it in 12 weeks. We even have a 12-week implementation manual that our Move Now doctors use this manual. They print it out for all their staff, and in 12 weeks you can be up and running. So it's exciting times. Check out our demo, movenowu.com. Demo.movenowu.com. So go to demo.movenowu.com. You can check out a 30-minute demo. Yes, 30 minutes. I've had some doctors that say 30 minutes is too long. You know what? Then this is not for you. If you don't want to invest 30 minutes to figure out how to be a better clinician, have better systems, they're diabetic neuropathy, okay? Because maybe that only takes 29 minutes. So for 30 minutes, you see an inside scoop of literally something that took us the last, I've been practicing 17 years, and there's stuff in there from almost 17 years ago. So it took us like the last 4 years to build this stuff. We try to sum it up in 30 minutes. Some other dimensions to this too that we don't even talk about in the demo. But watch students. Talk to Brandy, who's on this right now. She's our office manager. She's also Move Now doctor support. Talk to Vlad, who's also our doctor support. We have a team. And also, or like reach out to other doctors that are part of this program. I can connect you to a ton of them. If you have any questions about any other doctors out there as far as what they see in this program, how valuable it is, and how it really, really is like so out there. And I know this because I've seen all the other programs. We have just tried to completely over deliver on this thing so that you have every piece that you possibly could imagine to make this successful and smooth in your clinic. All right, it's cold. I'm going to get back inside. Go to demo.movenowu.com. Check it out. Comment below. Shoot us a message on Facebook. Go to our website, movenowu.com. You find our contact information there. Set up a call with us. We can get on. We can talk with you. We can let you know if we think, yep, there's just no way you can do this because of how your clinic is set up or because of your limitations, or we can say, yeah, you can get creative and do this, this, this. We've helped doctors do this that have all kinds of I guess, like self-imposed limitations, like assumed limitations that when we talk with a few minutes, we give them some ideas and they go, hey, I never thought of that. Never thought of repurposing my storage room to actually start rendering services and revenue out of that room. And so anyway, there's all kinds of ways to get creative with this.